Pyzdek Institute.
Thank you for joining us. My name is Juan Rivera, and I am honored to be hosting a team of experts who have done research on Lean Six Sigma in the healthcare industry in the era of COVID-19. Today, we are joined by Dr. Chad Laux, Associate Professor of Computer and Information Technology at Purdue University, Dr. Elizabeth Cudney, Associate Professor of Business Data Analytics in the John E. Simmons School of Business at Maryville University, Dr. Sandra Furterer, Associate Professor at the University of Dayton in the Department of Engineering Management, Systems and Technology. And presenting are also PhD candidates Manal Alduraibi and Gaganpreet Singh Hundal, as well as Senthilkumar Thiyagarajan. Joining the call with us is also Thomas Pyzdek, worldwide recognized Six Sigma expert and author of the standard reference for Six Sigma, the Six Sigma Handbook. Again, thank you for joining us. We are very excited for this presentation. If you have any questions during the presentation, feel free to post them on the chat box or YouTube comment section to the right of this player, or at the bottom if you're watching this on a mobile device. With that, I will hand it over to Dr. Laux and his team.
Right, thank you, Juan. Thank you, Tom, and thanks to all who joined us. And I think what we have is a presentation that we're going to share, and then we'll take some questions and answers. So what I'm going to do is talk about how this study came apart last spring. We, myself, and I think in every discipline, what was going through this is how can we contribute to understanding this pandemic. I've been talking with Dr. Furterer, Dr. Cudney, Dr. Antony, on and off very early last spring. And I think as we all were reading about problems and issues, early on we were talking about testing, but we quickly started talking about how can our field contribute. And I think broadly speaking, that's where the study came from, was what does Lean Six Sigma have to say about COVID-19? So we talked, and this research moved very quickly. I think we started really talking about it in early August, and we were done with the results by early December. So I think I could speak on behalf of my colleagues that it was about the fastest research I had ever been a part of. Good research, though. It was thorough, and broadly speaking, what we did is we reached out to a team of subject matter experts that Drs. Furterer, Cudney, myself, and Antony contacted, really just through a convenience sample to reach them and others to understand Lean Six Sigma's role with regards to healthcare, and what came out of that was primarily about resilience. So I will share it, and I'd like just to introduce and thank the rest of my team too. Manal, Alduraibi, Senthil, and Gaganpreet are all PhD students at Purdue University, PhD students of mine. And we have in our presentation just talk about a few things. Problem, I think we're all well aware of. But we went through some background literature. We realized that just what Lean Six Sigma has to say, what do we have to contribute with regards to COVID, is just too broad. So we had to focus our efforts. We'll talk about our methods, our data collection, and finally results and conclusions, and talk about where we went from there. And I am going to hand it over to my one of my PhD candidates, Gaganpreet Hundal, is going to talk about the problem as we saw it. So Gaganpreet, take it away, and I'll just move to this.
Good morning, everyone. My name is Gaganpreet Singh Hundal, and I'm a PhD candidate in the Department of Computer and Information Technology. And we collaborated on this research with all our team. So this research is basically based upon Lean Six Sigma for organizational resilience mechanism in the era of COVID-19. And as we all know, COVID-19 is a kind of a low probability disruption that has a high impact. So we talk about natural disasters and other disruptions. We know the pattern of it, but COVID-19 pandemic is a kind of disruption we never expected. And the important part is the decrease in the negative demands of the most important PPE kits decreased constantly. And this disruption you can figure out in this graph, that how we need to recover, and the disruption is for a long amount of time. So how we can use Lean Six Sigma principles and how we can build the resilience of the organization and supply chain so that we can see the unforeseen risks and demands we can forecast. So the literature of the Lean Six Sigma and our findings of this research also resonate with the some of the literature that has highlighted about the Lean Six Sigma applications in healthcare. So as you can see here, Lean Six Sigma principles from the operational perspective can be applied to basically streamline the operations, business operations, for example, the demand of PPE kits, and also about the emergency room management. That is one of the most important theme that came out from our findings. And the other thing is about making the supply chain resilient. So some of the tools such as failure mode effect analysis, and also the demand optimization and forecasting that can be used from the operational perspective, and Lean Six Sigma tools, some of the tools that we also find in our research in the findings, that value stream mapping and resource optimization from the real-time data that we need basically to streamline the operation. So some of the literature already talks about the Lean Six Sigma applications that is substantiated by the findings of our research that you will see in a couple of slides. The organizational resilience mechanism, that is a framework. And this framework consists of 4 different parts, focusing on people, focusing on processes, focusing on building resilience in training methods. So one of the themes that we focused, and also that is highlighted by the literature, is the training collaboration of the employees. So that is the important theme that also emerges from our research that helps to build the resilience mechanism in the organization. And also from the processes point of view, the operational perspective of building the resilience. So risk analysis and risk mitigation is the important theme that emerged. And some of the principles that our research talk about of Lean Six Sigma, such as failure mode effect analysis and value stream mapping, can be used to build the resilience of the processes. So the supply chain resilience, that is important also in this context. And we talk about this in our next slide, about the how we can build the supply chain resilience that can also make the healthcare operations robust. So some of the tools that we came out in our research, and our participants highlighted about some of the techniques such as 5S and visual management, that is basically Lean Six Sigma tools to streamline the processes. And also visual management in context of, for instance, one of our participants talked about the visual management in context of emergency room management. So we can basically make some markings and also highlight the areas for safe social distancing, and also some of the from the operational perspective, we can basically highlight some of the demand capacities of the bed, and also how we can basically use value stream mapping to streamline the queues from the operational management perspective. So building resilience in the organization and supply chain is some of the important aspect of our research. And next is the methodology that we followed, and with the research objectives. So research objectives, our research objectives focused on assessing the current knowledge of Lean Six Sigma and COVID, identifying the gaps of Lean Six Sigma and COVID, and its mitigation, some of the mitigation impacts on healthcare operations, and the defining some of the Lean Six Sigma tools for healthcare, building the healthcare resilience in terms of organization and supply chain resilience. So the next slide highlights about the methodology, and from here, I will hand it over to my colleague, Manal Alduraibi. She will talk about this in more detail. Thank you.
Everyone.
Thank you.
Thank you, Gagan. So for the methodology, we applied a structured literature review based on a keyword search with broad themes like Lean Six Sigma, healthcare, COVID-19, and organizational resilience. After that, we conducted the semi-structured interviews, and in this step, the structured literature review helped us to narrow the broader themes. Also, the research questions for the semi-structured interviews were developed from the narrow themes analyzed through the literature review. And the questions were open-ended, which allows us to have a discussion with the participants. And then we, for the analysis, we utilized content analysis method that aims to attain a description of the phenomena and concepts under study with the purpose of building a model, conceptual map, or categories. So the content analysis of the semi-structured interviews were conducted, and codes were developed, analyzed, and visualized by 3 raters in NVivo software. So the sample size and participants of our semi-structured interviews, here our participants were well-established, experienced, and represented a wide range of healthcare roles, organization types, and geographic areas. And the inclusion criteria of our participants were preferably credentialed as black belt or master black belts with at least 3 years of experience. The purposive sampling 21 was used to collect the qualitative semi-structured interview data from the experts in the field of Lean Six Sigma and healthcare. And as Dr. Chad before mentioned, the authors enlisted the SMEs known to the authors, who were conducted through emails with a description of the aim and goals of the study for subsequent consent. And the interviews were scheduled and conducted over a 4-week period in approximately 40-minute virtual Zoom meetings between SME and 2 of the authors. Yeah, so here we have the questions for these semi-structured interviews. How might Lean Six Sigma be applied to the current COVID-19 issue? What are the benefits of Lean Six Sigma that may be applied to COVID-19? What are the challenges of applying Lean Six Sigma to COVID-19? What tools and techniques of Lean Six Sigma could be applied? What are the potential area of Lean Six Sigma toward COVID-19? How has the organization responded to COVID-19? How has the pandemic changed the way that you prioritize and selected Lean Six Sigma projects? And how could Lean Six Sigma methods be applied to make hospitals more resilient to COVID-19? So for our data analysis, the internal validity of the findings from coded interview data was conducted following the triangulation approach with the structured literature review, thematic analysis data, and the participant research expertise knowledge. The inter-reliability check for the coded data analysis was conducted among the graduate students researchers as 3 raters, and the kappa value was greater than 0.70 among the raters. Continue to the data analysis. The coding of the interview data was based on these themes: COVID-19 response in healthcare operations, potential application areas of Lean Six Sigma for COVID-19 response in healthcare, benefits of Lean Six Sigma for COVID-19 response in healthcare operations, Lean Six Sigma tools for COVID-19 response in healthcare operations, challenges of applying Lean Six Sigma for COVID-19 response in healthcare operations, organizational resilience for COVID-19 response in healthcare operations, and finally, the supply chain resilience for COVID-19 response in healthcare operations. Now, my colleague, Senthil, will take over the findings.
Yeah, so good morning, everyone. So the overall findings which we obtained, we classified that into either proactive strategy or reactive strategy. So in the organization resilience, the proactive strategy is related to the activities which you can accomplish before a disruption like COVID-19 impacts organization. So I'll start with the proactive strategy. So some of the Lean Six Sigma tools which we can using the proactive strategy or SIPOC analysis and FMEA, failure mode effective analysis. So using these tools, we can map out each process in the organization and find out where are the points, weak points within the organization where we need to address risk that will affect the continuity of operations. And also tools like value stream mapping and process mapping will enable organization to map current process and enable them to redesign it. And also tools like simulation will help organization to see how the new state of process will be in place without actually implementing any changes. Some of the projects that can be accomplished to maintain resilience during COVID-19 is doing a continuous improvement projects to decrease process variation, and also creating some design for Six Sigma projects to improve technology within hospitals to collect real data and transfer them to cloud computing and making data analysis to make decisions. So what are the elements, organization resilience elements that are achieved through this projects? First one is flexibility building. So organization resilience should have adaptive capability. The first one is flexibility building, through which we can have build like cross-training workers so that we will have a variety of resources in place to make the continuity of process. And also the other proactive projects they can do is have an IT infrastructure for gathering real-time data and also monitoring key performance indicators. So next I'll move on to the reactive strategy. In reactive strategy, we can use tools like value stream mapping and also predictive modeling by gathering information like what is the infection rate within a particular county or area to predict how much patients will be admitted into hospitals next week or next month, so that the organization can proactively manage their operations. And other operations, they can other projects they can do in reactive strategies like creating some safety projects, preparing the workspace for both employees and patients, remodifying the patient flow so that the infection rate is reduced and enable the hospitals to operate normally, which includes redesigning process. And also other thing hospitals can do is reduce the process waste so that they will have more throughput through the operations. As I said, by predicting capacity, we can balance resources within the organization. So these are the COVID-19 responses we obtained from the findings, which is the first project is safety. We need to make sure that employees and patients are being safe when they are being treated in the hospitals, and also the infection rate is prevented when they are in the hospital. And also the next bubble which we found is process redesign. So during this COVID-19 impact, all the operations, usual operations are impacted. So we need to redesign the operations like changing the patient flow or even which dividing the hospitals into COVID patients and non-COVID patients, and this kind of changes have impacted hospitals. So Lean Six Sigma tools enable hospitals to map out the current process and how the new process will look like. Combined with simulation tools, we can see how the new operations will be taking place. And also this COVID situation has exposed the process gaps within the hospitals and created a lot of continuous improvement projects to attack those gaps. Along with this, we found that virtual care, providing, as we know, like everything went virtual during this COVID time. So offering a telehealth services will be with patients will prevent infections for both patients and doctors, and also reduce the traffic flow within the hospitals. Also, other findings we found, which is like creating a testing within the hospitals or outside the hospitals in a separate way to prevent infections, and also the revenue has been impacted because non-COVID operations has been either postponed or cancelled due to the high demand for COVID patients. So if the hospital is having enough capacity to handle both COVID and non-COVID patients, then that can be handled and improve the resilience of an organization. So these are the potential areas which we found from the study. Which the first one is business operation, which is like redesigning the process and also improving emergency room hospitals throughput, which enable organization to maintain their revenue generation. And other potential application of Lean Six Sigma, which we found from the studies, like administrative and also cleanliness, how we can set up protocols and standard operating procedures for maintaining the cleanliness within the hospital and making sure the sanitation process is happening in an established manner. And also other thing which we found from is like managing the waiting rooms, maintaining the social distancing between the patients and the employees, such that the employees are not being infected from the COVID patients. So the topmost resilience element which we found from the study is building flexibility within the hospital operations. That can be either training the employees to do multiple jobs and creating skill matrices to enable hospitals to manage both the demand and with the current resource of the hospitals. And as I said before, predictive modeling will help hospitals to predict how much demand will be coming up. Do they have enough resources in place to meet that demand? So having machine learning algorithms and data mining algorithms like classification or regression analysis will help organization to predict the demand. The important supply chain resilience elements which we found from the study is, as I said before, making the demand forecasting. For that, we need information like big data analytics, gathering real-time data, and also deciding what kind of analysis you want to make and what you want to predict. So some of the examples which we found from the study is predicting the number of beds we need and how much PPE we need, and also making sure we are using the existing resources PPE in an effective manner, and making sure we are reusing the resources we have in an effective manner by founding a effective sanitation process in place. And also making sure we have effective supply network in place so that the supply to the hospitals has been meeting up the challenges and the demand. So now I will hand over the presentation to my colleague Gagan to carry out the rest of the presentation.
Hello everyone. So some of the critical Lean Six Sigma tools for mitigating the impact of disruption like COVID-19 in healthcare operations, that the findings in our study reported that value stream mapping and failure mode effect analysis, as I talked about earlier, is very important and critical tools. So for instance, most of our participants reported on that there are certain risks that involve during this disruption, and we have to take an proactive approach in case of reactive approach to basically forecast these risks and how we can use the data analysis and real-time data to basically evaluate those risks and try to mitigate with Lean Six Sigma tools. So also there are certain operational bottlenecks that occur during the disruptions. For instance, there is shortage of PPE kits, there are shortage of other supplies. So what are the factors that contribute to those bottlenecks, and how we can remove the non-value added activities, doing the value stream mapping is important. That tool and project can be formulated on that. So also some of the statistical control approaches that Lean Six Sigma follows, we can use that basically to figure out the critical factors that contribute to the demand shortages, and also some of the critical risks that are there, and how we can basically evaluate those risks and prioritize those using Lean Six Sigma methodologies. The critical challenges that basically occur, and how applying Lean Six Sigma tools can be a challenge in terms of some of the challenges reported by the participants in our study. It's the quality of data and buy-offs and resource constraints. So the buy-offs means in the context of, for example, some employee becomes sick and they need to take their time. And also there are some other risk factors that involve that carry the additional resources. So the quality of data regarding how we can evaluate those risks and basically prioritize the factors that contribute to the resource constraints and risks. So we can basically build some technologies. For instance, the participants reported that they have to work around different sections in their organization, and they need collaboration, and because everything is online and virtual, they have to have some data platform, like cloud data platform, where all the data can be merged, and they can basically use that technology for real-time data analysis and finding out some of the patterns and the factors that contribute to the risks and resource constraints. So that is basically a challenge, how Lean Six Sigma methodologies can be modified to basically make the methodology more resilient towards the COVID-19 disruptions. So the next slide.
Sorry to interrupt. I have a question here from one of our viewers. He says, the tool slide mentions SPC and control charts. Were there specific use cases that would benefit from real-time SPC analysis? And if so, what?
Yes, a very good question. So, as our participants reported that, for instance, they have a bed capacity, resource constraint. So they have to monitor that on a real-time basis. The other is the patient income, the incoming patients in the hospital. So their number needs to be the real-time data needs to be shared and collaborated with different departments, because everything became online after a disruption of COVID-19, and during that, everything is data. So you have a real-time good quality data. You can basically in terms of the demand of the bed capacity, in terms of the PPE kits, in terms of the employee patient income. So all the data, the cross virtual data needs to be basically shared, and from that there's a real-time data demand. There's a theme that emerged from our study. So how different organizations within an organizations can collaborate on solving the risks, mitigating the risks, building the resilience in terms of also training their employees. So this is a case, a real-time data case. It can be like other cases as well, but we didn't, because we conducted this study. Most of our participants, they have some experience implementing Lean Six Sigma projects, but some of the participants, they said that that is what they think. They haven't started implementing Lean Six Sigma, but these are some of the critical things we experienced during the pandemic, and how Lean Six Sigma tools can contribute towards mitigating that. So, yeah.
Great, thank you.
So some of the conclusions that we draw from our study is that we have identified some of the critical tools and application areas where Lean Six Sigma methodologies can be applied, and those tools are important critical tools such as real-time data analytics, and after that following failure mode effect analysis, LSS tools, and visual stream mapping for streamlining the processes, some of the critical themes and LSS tools that can be used for building organizational resilience. For business operations, patient safety, and process improvements. And our study also highlighted about some of the challenges and the benefits of Lean Six Sigma. So from practical implications and further future research that can be conducted in this area, we are planning to do a project now where we are trying to basically do a survey study, not only in the healthcare, but what impact this disruption caused in manufacturing and other services industries, and how Lean Six Sigma can contribute to identify some of the critical tools that can be used for building the supply chain resilience and in manufacturing and services industries, and some of the tools that can be used to mitigate the risks. So the next study we are planning to do is empirical study to validate our framework that we have generated in this, and the idea is to basically do a survey where we can put some themes that emerged from our study in terms of how we can basically use value stream mapping to basically how we can develop on real-time data technologies. So how we can relate that with risk mitigation and building supply chain and organizational resilience. So that's all we have. Thank you very much for listening, and we are here for questions.
Thank you. I don't think we have an example from our study, not a specific FMEA application. It was more generalizable from our SMEs in terms of let's use failure mode effects analysis as a way to improve resilience in our healthcare organization.
Yeah, I was wondering, the just-in-time aspect of Lean, did that hurt us? Is that part of the reason why we didn't have adequate PPE when this started?
Yes, so that's a very good question, and that's in our research, one of the participants highlighted about they were following just-in-time lean approach and pull system, demand system, analyzing the market demand. But now, like during the disruption, there is a lot of demand fluctuation, and they can't follow just-in-time system. So that is kind of a trade-off. So the thing is, one of the emergent theme is that also came out, there is a hard time during this disruption that participants reported from their experiences about analyzing the actual demand, and they don't have data for that. So the requirement of the real-time data is a need that they said, and if they don't have a good quality real-time data, then they can't make estimates about demand of various supplies that are critical.
So this was really a discontinuity in terms of the all the events. So it happened, that here's before you have a process that's stable and in control, and all of a sudden it breaks. It breaks completely. The quality profession, including Lean, they emphasize rules and procedures. I'd say anticipation rather than resilience. Do they need to change their ability to adjust in real time or on the fly for these events, such as Operation Warp Speed did with vaccine development?
So the resilience element, it also deals with adaptive capability. So initially, even before COVID-19, when we are seeing the resilience, we just talk about reactive capability. But later, we started to see how we can make organization create contingency plans in place and also make sure they have enough flexibility and anticipation and agility built into their organization such that they can predict a disruption event, even in operations like running out of PPEs or critical resources getting scarce. So resilience includes both building that adaptive capability and also having enough strategic stock in place so that if a disruption impacts, they can use those stock to absorb the shock from the disruption.
And
Thank you.
I would like to add on that is our participants also reported that they need to basically keep track of all the risk factors that to learn a lesson from, like all the important risk factors from their experiences that occurred, not only from the suppliers or operational perspective, also like in context of some of the factors that inhibit them to do a good virtual training, the online technology, like shortfalls. So some of the events that they need to track, some of the factors that they need to track during the disruption, and then basically evaluate those risk factors so that they can have. Also, it makes a question of data. So if they have a data regarding all the events and the critical data, all the events and the that occur during the disruption, so that they can evaluate and learn from that, and also do some like kind of a predictive modeling in terms of supply and demand if the event occurred next time. So that is basically the organizations that learn from these disruptions, some of the critical factors that causes risk in their demands and supplies, and also from organizational perspective have been able to recover from those disruptions pretty quickly. So that is what resilience defined as.
I think to add to that as well too, one of the things that I think has been very interesting about this is to think about how most organizations are rolling out and implementing Lean and Six Sigma, because often it's still very much a silo approach, or we look at how the emergency room feeds into one department and we're looking at the impact directly there, but not from a systematic entire organization standpoint. And in other organizations like manufacturing, that works fairly well. You don't get a supply, it affects that product line and it might affect a few others. But from a healthcare perspective, when you have a pandemic like this, you've done Lean Six Sigma projects, maybe in obstetrics, or you've done it in the emergency room or another organization. And you have things that happen like the flu. And when that happens, you see some impact, right? And there's been resilience from that perspective. But I think this really showed us how we've got to look at resilience from that entire organizational standpoint, because even if we're predicting uses, and then there's great case studies out there in terms of, bedding and other supplies in a certain department and how they've optimized that and they can handle, ebbs and flows. But I think the pandemic really showed us that if we're not looking at this from a systematic perspective and how everything works together, then our supplies really get thrown off. And I think, unfortunately, some healthcare organizations were caught off guard because it wasn't how do we take some supplies from the cardiac unit and move them over here, because we're still operating very much as a silo in a lot of organizations. And that's where the resilience in some of these tools, in failure modes and effects analysis, like the one question was asked, we do a great job of contingency planning, but we do it for that operation and not, again, from a systematic organization wide. And I think that was one of the really interesting things that came out of this study.
So you're saying, I think, that you need to look at the value stream and the steps within the value stream at a higher level. So you model that and extend it to the entire organization to optimize the use of resources.
Right.
And I would just add, too, to connect the data in all those steps is really important from a finding of the study as well, because the the healthcare organizations tend to look at alerts within each process step, but they're not connecting the entire value chain for their data and their alerts for what's not working.
Right, absolutely. If you think of, most hospitals, probably all, have some sort of contingency plan if there's a power failure, because you've got individuals on respirators and an ICU, and they've got to think about what happens with that. But I don't think one of the things we found where people were thinking about some of the basics, like the gloves and the PPE, right? And so there are those systems in place, but how do we look at it from a broader perspective?
Yeah.
Okay, well, I think those are all the questions we have right now. We, a lot of people weren't able to make this time slot, but we're going to make this webinar available. We recorded it and we're going to make it available to people. We'll send you a link so you can share it with your contacts, and any questions that arise from those. It'll be like an evergreen webinar. We'll forward them to you.
Great. Yeah, I'd like to thank the students especially. I mean, they really led quite a bit of this work, and maybe a push in the back, but they really they did a great job. So
yeah, great job,
congratulations.
Guys. Thank you.
Much needed research.
Yeah, it is. It's a great experience.
Okay. Well, thank you very much for joining us. We really appreciate the time that you took to present your findings, and we'll be in touch.
Great. Thank you.
Thank you, everyone.
Thanks.
Have a
Bye,
great
guys.
day, great week.
Be safe.
Yeah.